Now, this is the last lecture on enzymes. Today, we will discuss the clinical enzymology. And we will discuss the clinical enzymology under three headings. One, clinically useful enzymes. Second, enzymes as medicines. Third, enzymes as reagents. Now, first of all, clinically useful enzymes. That there are lots of clinically useful enzymes for detection of different diseases and related to clinics. But we will discuss here just few of them because it is beyond our scope to discuss all the clinically useful enzymes here, and also at this time, that is in the year of first year, it is not needed by you. So we'll discuss few of them, which is important for you from examination point of view. Now, first one is LDH, lactate dehydrogenase. Now, LDH catalyzes a reversible interconversion of pyruvate and lactate. I have shown you the reaction. Now, 5 isoenzymes of LDH are known with different subunit composition. H and M subunits are encoded by different genes, predominantly in heart and muscles respectively. Heart, brain, RBC and muscles are major sources of LDH isoenzymes. I have already told you the function of LDH, that is, it catalyzes a reversible interconversion of pyruvate and lactate using NADH, NAD as the coenzyme. Serum LDH activity levels in heart attack or myocardial infarction, MI. Myocardial damage release LDH1 in serum in large amount. So the total LDH level is very high, and it is mainly due to LDH1, that is H4, which may increase up to 10 times. Flipped ratio. The LDH1 is to LDH2 ratio is less than 1 in normal healthy persons, but this LDH1 is to LDH2 ratio becomes more than 1 due to increase in LDH1 activity. This reversal of ratio from less than 1 in normal individuals to more than 1 in MI is called flipped ratio. Time course in MI, blood levels start to increase by 10 to 12 hours after the onset of MI. Peak is attained after 40 to 48 hours and return to normal by 5 to 6 days. LDH in other diseases, liver diseases with hepatocellular damage like in hepatitis, usually LDH4 and 5 rise more. Hemolytic anemias, LDH2 rise more. Molecular dystrophies, LDH5 rises more. And I have shown you the table where you can find the different isoenzyme LDH1, 2, 3, 4, 5, their type, electrophoretic mobility, tissue of origin, and serum concentration. Second one is CPK, creatine phosphokinase. CPK has 3 isoenzymes, CPK 1, 2, 3, due to differential association of 2 subunits B and M. CPK2 is also commonly called CPK-MB. You see that table. These subunits are coded by different genes on chromosome 14 and 19. And I have shown you the table, that is isoenzyme CK1, CK2, CK3, molecular form BB, MB, MM, tissues of origin brain, heart, skeletal muscle, serum concentration roughly 1, 5 to 9 and 90%. Function. CPK is important for production of creatine phosphate. This is a phosphagene, a very high energy compound which helps in maintaining ATP concentration. And I have shown you the reaction in the above part of the sheet. Creatine phosphate, high energy compound, keeps ATP concentration. So actually, CPK is important for production of creatine phosphate. Now, CPK in heart attack, MI. Total CPK high, CPK-MB rises mainly, no effect of hemolysis, earliest rise start by 3 hours, peak in 30 hours, normal return in 3 days. CPK-MB is most useful in MI, especially when ECG changes are not clearly indicative of MI. Magnitude of rise corresponds approximately to size of muscle infarct, indicating severity of MI. CPK in muscle damage and disease. Total CPK rises usually more than 500 international units per liter and may go up to 1,500 international per liter. Rise is seen in crush injuries, fractures and muscle dystrophies. CPK in cerebral stroke. Total CPK and CPK2 rise seen in cerebral stroke. Clinical use. Routinely, total CPK is done for muscle damage and CPK-MB is done as suspected cases of MI. You keep an eye over the lower part of the sheet where time course of LDH, SGOT, that is AST and CPK-MB in myocardial infarction I have shown. Now let us come to the discussion of transaminases, of which important one is SGPT and SGOT. Transaminases catalyze the reversible transfer of amino group from amino acid to keto acid. These enzymes are used in the catabolism as well as anabolism of amino acids that you know. The two major transaminases are ALT, alanine transaminase, also called SGPT, or serum glutamate pyruvate transaminase, and second one AST, aspartate transaminase, also called SGOT or serum glutamate oxaloacetate transaminase. SGPT and SGOT are more popularly used in clinical practice. AST is present in many tissues like RBC, skeletal muscle, heart, liver, kidney, etc. However, heart and liver has the highest concentration. Normal level is round about 8 to 20 international units per liter. It rises in myocardial infarction many folds and follows the time course between that of CPK and LDH, that is starting rises 12 to 24 hours after the onset of MI, reaches peak by 2.5 days and returns to normal by 4 to 5 days. Rise in MI is usually very high. Moderate rise is seen in liver diseases and hemolytic anemia. ALT is also present in most tissues, but liver has the maximum amount. Normal 10 to 30 international units per liter. Marked rise is seen in hepatic cellular damage up to 50 to 100 times. In viral hepatitis, which is a common disease in our community, particularly you are vulnerable in hostel occupancy, because this viral infection often comes from the water. That is, the source of the virus almost becomes water, and if one of you contact you, it may spread to your fellow mates. So, marked rise is seen in hepatic cellular germen up to 50 to 100 times. In viral hepatitis, rise in ALT is greater than AST and level of 2 to 5,000 international unit per liter are common. ALT is more specific for liver diseases than AST. Next important enzyme for your examination point of view is the alkaline phosphatase. Alkaline phosphatase catalyzes the removal of phosphate group from a wide variety of organic phosphates at alkaline pH. It is present in many tissues and has many isoenzymes such as bone, placenta, intestine, liver, etc. Alkaline phosphatase in osteoblast hydrolyze organic phosphate in bone matrix to release phosphates for mineralization. Normal level 3 to 13 kilangstrom unit per deciliter or 40 to 150 international unit per liter. In children, level up to 20 kilangstrom units are normal. 1 kilangstrom unit is defined as the amount of enzyme activity capable of producing 1 milligram of phenol in 15 minutes at 37 degrees centigrade from dinitrophenol phosphate. This kilangstrom unit is still used in clinical practice. Therefore, I have told this one. Otherwise, you can remember the international unit level of alkaline phosphatase, that is from 40 to 150. Now, ALP level increases in many diseases. That is one, obstructive liver diseases, then in bone diseases. As you have already known that different isoenzymes are present in bone, liver, placenta and intestine. So from your common sense, in obstructive liver diseases, obstruction to flow of bile is commonly due to the gallstones obstructing common bile duct and carcinoma of the head of the pancreas. This causes rise in alkaline phosphatase level at least 3 to 4 times the normal level. In hepatocellular damage, it rises much less. Similarly, in bone diseases, alkaline phosphatase also rises in bone diseases such as rickets, osteomalacia, Paget's disease or cancers of the bone. Placental isoenzymes increases in pregnancy. The bone isoenzyme is present maximum in concentration, that is 50%, and increases in growing children diseases of diseases of bones like rickets, osteomalacia, and cancerous infiltration of bones. Now, alpha-1 or biliary ALP is produced by biliary canaliculi. It rises in obstructive jaundice that I have told you. Second, alpha-2 or hepatic ALP is produced by hepatic cells. That also has been discussed. Placental ALP is also alpha-2, but it to heat stable, it increases in pregnancy. It is heat stable isoenzyme. And P beta alpha or bone ALP, it is heat labile and is roughly 50% of total plasma that I have told you. Next comes acid phosphatase. Acid phosphatase is similar to alkaline phosphatase, but its optimum pH is acidic, that is 4 to 6. High levels are found in cancers of prostate glands. So it is estimated when suspicion of cancer of the prostate gland comes in mind of clinician. Next important, amylase. Amylase is produced by pancreas and salivary glands, and both act on starch to produce maltose, isomaltose, glucose, etc. Both salivary and pancreatic amylases are alpha amylases. Normal level 50 to 120 international unit per liter. Another unit, normal serum level, is also expressed by somogai. That is, normal serum levels are 80 to 180 somogai units, or that I have told you 50 to 120 international unit per liter. High levels of amylase are seen in acute pancreatitis up to 1000 units per liter. It is very serious and life-threatening condition. and also amylase may increase in moms. Next comes lipase. Lipase is also a pancreatic enzyme which hydrolyzes the triglyceride to monoglyceride and fatty acids. Lipase level increases in acute pancreatitis. This rises more than amylase and lasts longer. Enzymes commonly used, these are, I have already discussed you. These enzymes you must read for your examination purpose. Enzymes as medicines. Number one, streptokinase. Streptokinase is an enzyme obtained from bacteria Streptococcus. It causes the lysis of intravascular blood clot. In coronary artery disease and myocardial infarction, the basic abnormality is the formation of thrombus in the coronary artery. Hence, it is used in the treatment of MI to dissolve blood clot. Second is pepsin and trypsin are used as digestive enzymes in pancreatic insufficiency, leading to poor digestion. And asparginase is used as anti-cancer drugs. So enzymes as medicine, I have just told you few names. There are lots of enzymes as medicines. I have, for example, just you have uttered few names. Now the last topic, enzymes as reagents. Number one is restriction endonucleases. RE. Restriction endonucleases cut DNA at specific sites. They are an essential and important tools in the genetic engineering technique, such as DNA fingerprinting. DNA fingerprinting is used in medical legal cases to identify the real culprit or a victim. Similarly, DNA fingerprinting is also used in settling the paternity devices. And second one, in clinical lab, enzymes in clinical lab. There are a few examples. These enzymes are used in the clinical laboratory as reagents to estimate various compounds in blood to diagnose diseases. For example, glucose oxidase for estimation of glucose in diagnosis of diabetes mellitus. Similarly, cholesterol oxidase for estimation of cholesterol to evaluate the atherosclerosis, and peroxidase and ALP for estimation by ELISA, which is used in the diagnosis of many diseases.